Hi everyone, I hope you're doing well today. Our usual first project in Anatomy 2 is taking a look at different careers in the medical field. As students in Anatomy 2, typically people are interested in going into something in the medical field and kind of have some idea as to what that might be. So we take a little time at the beginning of the year to look into those things. We'll look at the schooling requirements, different degrees, and experience that might be needed for different careers. So we're still going to do that. What we normally start with is spending the class period going through and making lists of medical careers that you might have heard of before, that you might be interested in, then sharing those out with the class, talking about what each of those is. So what we're going to do, I have a list that we normally would have most of what comes with it, or what we would come up with, in class. So we're going to go through half of that list today. I'm going to go through and talk about what each of those does briefly, and then you're going to have just a matching assignment to make sure that you are able to remember what each of these careers would typically do and be responsible for. There are 38 on my list altogether. There are clearly way more than that, but I have 38 on my list. So we're going to do 19 today in part 1, and then tomorrow we'll look at the other 19 in part 2. They're going to go in alphabetical order. So again, we'll go through the first half of my list today, and we'll finish the rest tomorrow. First, we have an anesthesiologist, and some of these you may have heard of before, maybe even something that you're interested in pursuing, and then maybe some of these you haven't heard of, and you're not really sure what they do. So we're going to go through them, but an anesthesiologist is a doctor, so it would be a physician. You'd have to go to medical school. When a patient has surgery or even some kind of sedation for a medical procedure, the anesthesiologist is responsible for, quote, putting the patient to sleep, so they're not aware of what's happening during the surgery. They're also going to help to manage and make sure that their breathing is okay, their heart rate is staying normal, their blood pressure is normal, and they'll also help to manage pain for the patient after the surgical procedure. Next, an athletic trainer. If you are involved in sports here at BHS, then you are familiar with Taylor. She is our athletic trainer here. But an athletic trainer you would need to be certified and licensed to become an athletic trainer, and you would work in the field that would be considered sports medicine. And they're going to be really responsible for helping to treat and prevent injuries. Next, we have an audiologist, also a medical professional. There's different levels of degrees you could have to become an audiologist, but this kind of person would be able to diagnose and manage and treat hearing loss or hearing problems, as well as balance issues. If you think of audio as in like you're listening to something, it relates to your ears and how they work. And you actually have fluid in your inner ear. And if you stand up too quickly, or you're laying down and you stand up very quickly, that fluid can kind of move, and that's what makes you feel dizzy. Some people have issues with that on somewhat of a regular basis, so they would need to see an audiologist to try to find ways to correct that. Next, we have a cardiologist. Cardio refers to your heart. So this would be a doctor who would specialize in anything relating to the heart and the blood vessels. So they would be able to diagnose and treat different conditions with that system, the cardiovascular system. Next, a dentist. It's also a doctor or physician who is going to treat teeth and the gums. They would also possibly provide dental cleanings and also take x-rays and look at x-rays to make sure that a person's oral health is being maintained. And they would help find ways to rectify any issues that a person might be having with their teeth or their gums. Dermatologist, if you think back to Anatomy 1 when we learned about the skin, hopefully you remember the layers of the skin. You have the epidermis, which is the top layer of skin. Below that, the bottom layer of the skin is the dermis. So that's where dermatologist comes from. So they would specialize in any condition involving your skin, your hair, or your nails, and treat different things like that. Some dermatologists also would do like some cosmetic things with skin, but that isn't the case for all dermatologists. A dialysis nurse obviously would be a nurse, but they're going to work with patients who need to receive dialysis treatments. Dialysis is an artificial filtration of the blood. So the job of your kidneys is to filter and clean toxins out of your blood, clean metabolic waste out of your blood, make sure that your fluid balance is staying in check. So when people's kidneys stop working, they need to get dialysis treatments, typically 3 times a week, 3 to 4 hours at a time, sometimes even longer than that. So the nurse would be responsible. In the picture here, you can see a dialysis machine. A person would have like an access site, typically in their arm, so the dialysis nurse would need to put some needles into their arm at that access site, and some of their blood, a small amount of their blood, is taken out and run through the machine that you see in the picture. It's cleaned, wastes are filtered out, and that clean blood is put back into the person. Then a little bit more blood is taken out, and the same thing continues until their blood has been adequately filtered for them. Next, we have an ENT, or an ear, nose, and throat doctor. They're also called an otolaryngologist, if you want the technical name for that. So this kind of doctor would manage any diseases that would affect the sinuses. So if a person had chronic sinus infections, or chronic laryngitis, they would go see an ear, nose, and throat doctor. Next, we have the emergency room nurse. I have department here with this because hospitals actually do not call them emergency rooms anymore. They're called emergency departments. So I figured just this way you would kind of get that information. So an emergency department nurse or an ED nurse would treat patients who are coming into the emergency department. It would be usually some kind of trauma or injury that happened. Anything that's going to require very quick care to help them stay alive, essentially. Not in all cases, but in some cases, it might be a life or death situation. So if you think you might want to be a nurse, and you like really fast-paced things and, thinking quickly, the emergency department might be a place you would want to work. We also have an emergency department doctor, would be a doctor who would do similar things, as far as like making sure a patient is stabilized. There are some cases where, an emergency room or department doctor would do more things than others. Sometimes they really just figure out what the patient needs right away and then refer them to be admitted to the hospital so they can see a specialist, or just see a specialist as an outpatient. Again, a very fast-paced, high-stress job. So if that's something you are interested in, then that might be a career path for you to consider. Next, the family practitioner is really just a family doctor. They are going to treat all body systems, essentially, so they need to know a lot about how the body works. This kind of job might be good for people who don't want to have like similar days every day. You're not sure what each day is going to bring. It's not going to be as similar day to day as, like, say, a cardiologist, for example. A gerontologist, there are different kind of levels that you could work in this field. This field is going to treat elderly people. They are going to focus on aging and different issues that happen as people age throughout their life. There are research gerontologists, so looking at things like in a lab setting. So, that might be a consideration if you want to work in a lab and you want to help kind of solve some issues for people as they age. You could be a physician and be a gerontologist. More and more of our population is getting older all the time. So this is going to be a field that will need people to go into it. So it's, again, something else to keep in mind. Next, we have a hospice nurse. It really takes a special kind of person to be a hospice worker in any capacity, because you're really providing care for patients at the end of their lives. For the most part, you would know that if a patient comes into hospice for end-of-life care, that they are terminal, you're going to be losing your patients all the time. So it really, to be a hospice nurse takes, like I said, a really special kind of person. You need to be able to comfort people, and you also would have to kind of comfort their families and things like that. So if you feel like you are able to provide support for people, that might be a good option for you. Next, we have an intensive care nurse, or an intensive care unit nurse, an ICU nurse. This would be a nurse who works in the ICU, the intensive care unit, and you provide a lot more one-on-one care for patients in the ICU than you would on a regular floor as a nurse. You would need to monitor the conditions of the patient, possibly give them some treatment like medications, IVs, things like that, and just kind of help them as they recover from whatever the issue is that they were in the hospital for, in the ICU for in the first place. Next, we have a labor and delivery nurse. So this would be a nurse that would typically work with an obstetrician, doctor that delivers babies. A labor and delivery nurse would help families and the mother through the birthing process, and also help to provide or give care for women during their pregnancies as they're getting ready to deliver. Next, we have the neonatal intensive care nurse, or the NICU nurse, the neonatal intensive care unit. That would be where babies go that are born prematurely. They're considered medically fragile and need a lot of treatment, a lot of monitoring. So you would work with premature babies in this case. Typically, you would have your patients, which would be these premature babies. Depending on how premature, they could be in the hospital for months. One of my cousins and his wife had triplets that they're actually in middle school now, but they were born in June of whatever year it was, and she wasn't due until September. So they were actually in the NICU for a few months. They didn't come home until, I think, the end of that September or beginning of that October. So there are cases like that where you would have patients for a long time. You develop relationships with the families and things like that. Next, we have a nephrologist. So again, if you remember back to Anatomy 1, the nephron is the filtering unit of the kidney. So a nephrologist is going to treat a patient with kidney problems. This kind of doctor would also work with a dialysis nurse that we mentioned earlier. So some of the patients that would see a nephrologist would be on dialysis. So part of what the nephrologist would have to do is monitor the blood levels of the patient and make sure that their dialysis treatments are working, and then adjust that accordingly. Next, we have a nurse anesthetist. This would be kind of a specialty area of being an RN or a registered nurse, but they would have a lot more responsibilities than, let's say, an RN or a registered nurse working on a regular floor in a hospital. So a nurse anesthetist, you're going to need more training and more education than stopping right after you would have an RN degree. This job, what you would do is you would work with an anesthesiologist typically. You would help monitor the anesthesia for the patient during surgery. This is actually a really good profession to get in. So if you're interested in anesthesiology, but maybe you don't want to go to medical school and become an anesthesiologist, this would be a good alternative for you. Another thing to consider, which I haven't mentioned yet, I don't think, is physicians and doctors need to carry malpractice insurance in case anything happens and they were to get sued by a patient. So an anesthesiologist is one field that those doctors have very high malpractice insurance rates that they have to pay. just because there are so many things that can go wrong with anesthesia during surgery. And as far as I know, a nurse anesthetist doesn't have to worry about that because they're overseen by the doctor. So if you're interested in anesthesia but don't want the full responsibility or have to go to medical school and that kind of thing, then this would be a good field for you. And then our last one for today is a nurse practitioner. A nurse practitioner can do, again, a lot more than simply a person with an RN degree would do, as there is additional education and training required to become a nurse practitioner. But they are able to kind of interpret different tests that a person might have. They are able to diagnose and come up with treatment plans for a patient, but they are overseen by a doctor. So they can come up with a diagnosis, they can come up with a treatment plan, but that has to be run by a physician before it can, or before they are able to actually start working on that treatment plan, for example, or start administering medication. So they would have to work closely with a physician to kind of have everything okayed off by the doctor. So as I said, that's going to be our last one for today. What you're going to do now that you have watched this video is go into Schoology again, into our folder for today, and there should be an assignment there for you. It's going to show as an assessment, but it's just classwork, and you're going to complete that and submit that assignment. It's just matching with these 19 medical professions and with what they do, essentially. So if you've watched this and kind of go through it, if you need to go through it again, you're more than welcome to. So complete that and submit that. And then tomorrow we will go through the other half of the list, and you'll do something similar for the rest of the what I have on the list for medical careers or careers in the medical field. And then what we're going to be doing is you'll be signing up for a career that you would be interested in from this list. I also have an option where if you are interested in something that's not on my list, you would be able to look into that. So this, I want to make sure it fits you and is as useful to you as possible. So if you have any questions on what you need to do today or concerns or anything, please just reach out. You can email me or send me a message on Schoology, and we'll be back tomorrow with the other half of our list. Have a good day.